With aging, we shouldn't be tooth-based when we are checking ourselves. It's really the holistic, the well-being of a person, because a lot of our systemic conditions can actually affect our mouth.
We have to take care of our oral hygiene. It entails a lot of adjustment when you have a denture.
As we age, we encounter physical changes in our bodies. Elderlies experience difficulties in eating and are at risk of malnutrition. Even their oral health is affected. Today on the program, we'll discuss healthy lifestyles for elderly, including caring for their teeth and getting proper nutrition. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk. As we grow older, we put ourselves at more risk for oral health problems. To tell us more about this, with me today is Dr. Cez Acero Taping, who is a restorative and cosmetic dentist and who's also the section head for restorative dentistry at the College of Dentistry at the National University. Hello and welcome to MedTalk Health Talk, Dr. Cez. As one ages, pagdating sa ating ipin, Dr. Cez, what are the changes that one can expect?
Although it does not apply to everyone, but most commonly, it's missing tooth or tooth loss. There's also bone resorption or yung bumababa ng ating mga buto. Periodontitis or gum problems also happen. And of course, for those people who had dental cavities way back, tapos hanggang sa tumagal, syempre discoloration of tooth, hanggang slowly na i-exfoliate na yung mga ngipin. So those are the usual problems that we see as people age.
Pag-usapan natin yun, you mentioned how some of these problems, it actually stems from years back. Importante ba dito yung kumbaga habits ng mga tao when it comes to oral health care?
Yes, very important. As they say, prevention is better than drills and fills. So very important po yun na simula pa lang pag may nakikita na tayong cavities, kumbaga at the onset of it, napapastahan na, nare-restore na. Because it could lead to something else. First, pagka nag-extend na yung ating lesions or yung mga cavities natin, pwedeng maging infection yan. Kaya nagkakaroon tayo ng root canal treatments. Pag mas napapabayaan or kumakalat siya to the outside environment of the tooth or the periodontium, doon nangyayari yung periodontitis. Nagkakaroon ng bone loss. Pag bone loss na po tayo, of course, ang nangyayari, missing tooth na.
We want to discuss also the importance of prevention. So pag-usapan natin a little bit, Dr. Cez, how to spot these problems before they actually occur. So how can our viewers know or spot cavities or dental caries, periodontitis, and gingivitis?
First, Doc, sa cavities, akala nila if it's black, that's the time they have to bring it. To be honest, it starts as a white spot. Those white spots are called demineralization. Lumalambot na po yung surface ng ngipin. So dapat pag nakakakita pa lang tayo ng mga white spots sa ngipin natin, pwedeng fluorosis yan, pwedeng demineralization. So if you see anything white, punta na agad sa dentist. That I see white spots here, is it soft? Malambot ba yan? Kasi if it's soft pa lang, we could do minimally invasive treatments such as preventive resin restorations. Tatanggalin lang yun, scrape off lang yun without drill, lilinisin, pag hard na yung tooth surface, papastahan. So, second naman, pag nakikita natin na lumalaki na, pa-black na yun. Yun na yung advancing caries. Ibig sabihin po, active na siya. Malalambot na to, may smell na siya, tapos nagli-lead po yun sa pain. So, actually, yung pain or sensitivity na nafe-feel natin, pa-advance na po yun.
Okay.
So, dapat before pa lang, nadadala na siya.
So how about gingivitis? And explain natin kung ano yung periodontitis.
Gingivitis naman, as they say, if you see anything red, consider it as a red flag. So that's inflammation. It starts always as namamaga. And then when you brush it, mapapansin mo, Doc, when you spit out, there's blood. So you have to bring that immediately. Because if mapabayaan natin yung gingivitis, it could lead to periodontitis. And periodontitis, hindi na yan basta-basta nadi-deal with lang ng simpleng brushing, home care. You have to bring it to a periodontist who would do scaling and polishing. Sometimes it could be non-surgical, yung iba surgical na, bubuksan na yun, kukunin yung nasa loob. So we don't want that because periodontitis would always show or manifest mga bone loss. Kaya nag-uugaan yung ngipin. Actually ngayon, Doc, akala nila cavity ang problema. Ang cavity, mare-restore yan. Ang perio or periodontitis, kapag nagtuloy-tuloy po yan at nagugaan na ang ngipin, yan ang mas problema. How to make it stay?
Balik tayo sa cavities. A lot of our viewers are pretty aware na kapag mahilig kumain ng matatamis, candy, ito ang sanhi ng cavities. Ito lang ba ang nagkakos ng cavities?
The main thing that causes cavities, number 1 is dry mouth. Number 2, pag mababa ang salivary pH natin. Kasi kahit anong kain natin ng matamis, basta pagkatapos na nakapag-toothbrush tayo, nakapag-mouthwash tayo, hindi yan magpo-progress. Pero kapag tuloy-tuloy na mababa ang ating salivary pH, yun na ang onset ng dental caries. So, dapat, kikip natin palagi yan na neutral lang yan, Doc, at palaging dapat maganda ang salivary flow mo. Kasi pag dry ang mouth mo, kahit nga hindi ka mahilig sa matamis, basta dry ang mouth mo, may dry mouth ka or xerostomia, magtutuloy-tuloy po yun.
Is brushing of the teeth the one and only way to take care of our teeth well?
Well, it's one of the good ways to take care of teeth. Kasi sabi nga nila, Doc, yung contact time, yun yung iniiwasan natin. And to be very efficient, kailangan actually binabrush natin yung teeth at least 2 to 3 times a day. Para yung contact ng pagkain sa ngipin ay nawawash off. At hindi lang po yun, Doc, kasi meron din areas that are hard to reach. Yung mga areas na yun, kailangan natin i-floss. With flossing kasi, natatanggal natin yung mga food na naiipit sa gitna ng ating mga ngipin. Kaya if you notice, Doc, may mga sirang ngipin sa gitna, nangingitim. Because yung mga areas na yun, may food impaction or may plaque na naiiwan, hindi nila natatanggal properly with just brushing. And of course, lastly, mouthwash. And you have to use a mouthwash that doesn't have alcohol or is not acidic. Kasi kailangan, Doc, yung mouthwash, mababalik niya sa tamang pH yung ating oral cavity para hindi siya nagtutuloy-tuloy into acidic that could cause cavities. So, brush, floss, and rinse.
Now, you also mentioned about xerostomia or pag dry mouth. Is this something that's inevitable as someone ages? Is this part of aging?
Well, Doc, it's a case-to-case basis. Usually, ang dry mouth, makikita natin yan pag may systemic condition and those who are undergoing radiation therapy. With aging, mas makikita natin dyan yung mga nagkakaroon ng bone resorption sa mga may diabetes.
Now, before we go, Dr. Says, do you have any more tips or advice for our viewers?
Well, first is, always ask your dentist if you are in doubt. Pangalawa po, brush your teeth. The magic number is 3. Kung kayang 3 times a day, for 3 minutes, the better. And then, lastly po, as I always say, prevention would always be better than drills and fills. So maganda, makip natin yung practice na we brush, we floss, and we rinse.
We really learned a lot, and it's also really important for our viewers that they get the right information from people who are qualified to give you that type of information. So always visit your dentist. Have a good relationship with your dentist as well. In the meantime, we will pause for a break and ask the question, are dentures inevitable as we grow older? More on this when Med Talk Health Talk returns. As we age, our oral health changes, and some of us might even need dentures. Now, to help us learn more about what dentures are, we're joined today by Dr. Jomer Pasol, who is a professor of prosthodontics at the National University and who is also a registered dental technologist. Pag-usapan natin, Doc Jomer, kung ano ba talaga itong dentures or also known as false teeth, kailan ba ito kailangan? Is it inevitable na pagtanda ng isang tao, kakailanganin niya ng dentures?
Pag sinabi po nating dentures, ito ay mga artificial substitute ng ating ngipin na natatanggal. So, of course, as we age, we have to take care of our oral hygiene. Removal of teeth, okay, these are causes of poor oral hygiene, dental caries, and of course, periodontitis or periodontal diseases that will lead later on to mobility and at the same time, removal of the tooth.
Ang important dito, aside from the dentures fitting properly, kaya dapat sa tamang mga doktor pinapagawa ang ating mga dentures. What should our viewers know when it comes to proper care of dentures?
Alam natin na it's important that we go to dental clinics, to licensed dentists. We have to make sure that the dentist will treat us very well in terms of course, assessment. They have to assess the patient medically, dentally. And at the same time, when we do the proper procedure, tama ang ginagawa ng ating dentista o ang ating doktor, which I think lahat naman ginagawa yun. Ang pustiso, ginagawa yan for us to replace what is missing. Let's say, function, mastication, speech, and even appearance ng isang tao. It has a lot of effect. So, we need to replace them. We need to bring it back again to our patient. So, there are a lot of factors that we consider when we do our dentures.
Ang pag-care ba ng mga dentures ay parang regular na ipin lang din? Are there any special things that our viewers should note about?
Unang-una sa lahat, especially pag complete denture, no? Itong mga ating elderly patients, okay, pag sila'y natutulog, kailangan alisin nila ito so that we will be relax our gingiva and at the same time our alveolar ridge or yung bone na natira. So remember, yun lang yung makapaghawak ng ating denture. So, because as we all know, the masticatory forces, yung pagkagat, mas mabigat kapag ang tao ay tulog kaysa pag ikaw ay gising. So, pag ikaw ay naka-denture, complete denture, you need to remove that every time you're going to sleep. How to take care of it? You can use soft bristle brushes to brush the denture. Kasi ang denture meron niyang dalawang surfaces. We have a polished and unpolished surface. Pag sinabi mong unpolished, ito yung nakadikit doon sa ating gilagid. And yung polish, ito yung pag ngumiti siya ay makintab, no? Parang gilagid. So, we have to maintain the smoothness of the polish area. Pwedeng gamitin yung liquid dishwashing soap, panglinis din ng denture para hindi siya masyadong maging abrasive.
So it doesn't need to be expensive, to take care of dentures properly.
Although there are a lot of denture cleaners that are available in the market, but you can use that.
For dentures that have been properly fitted, properly made by who is licensed and who knows what they are doing, panghabang buhay na ba ito?
Hindi siya panghabang buhay because it will depend on how the patient will take care of it. A denture that lasts for 5 to 7 years, okay na siya to be replaced. But of course, we do not tell our patient, hanggat buhay ka, buhay ang denture. Hindi. It will depend on how the patient will take care of the denture. Anong habit niya? You just have to educate your patient. No? Once na in-install mo, inilagay mo yung denture, it's a manner of how you educate your patient as well.
Now, Doc Jomer, a lot of our viewers may be aware when it comes to dentures, nakikita nila sa movies, lalo yung mga comedy skits where someone would talk tapos matatanggal ang dentures. Is this a fact of living with full set of dentures? Ito ba normally pwedeng matanggal dun sa mga instances na hindi dapat?
Dapat hindi po, kasi dapat yan ay well-fitted sa ating mga pasyente. So, pag ganun ho, you have to visit your dentist. Probably you need to change the denture or if you have to reline it or rebase it para mag-fit siya. Hindi siya pwedeng pag tumawa ka, matatanggal. Dapat yan fit tayo sa pasyente.
How about some quick do's and don'ts naman, Doc Jomer, when it comes to having a full set of dentures?
As what we are telling to our patients, loosening of teeth are caused by calcular deposits, dental caries, periodontal diseases. Halimbawa na lang po, pagbisita sa dental clinic or sa dentista mo, you should visit at least twice a year, every 6 months, no, to check. Not all Filipino does it. Pupunta na lang sila sa clinic pag, ayan na ho, masakit na, wala na tayong remedy but to remove. So, we have to prevent that so that we can be able to still have a complete set of teeth even though we are old. It's not that easy to wear a complete denture kasi it entails a lot of adjustments sa part ng pasyente. Nandiyan na mag-iiba yung panlasa mo at start, pananalita mo.
Very good advice there, Doc Jomer. Before I let you go, do you have any final tips or advice para sa ating mga viewers, especially when it comes to getting the correct dentures fit, getting it right the first time?
You just have to visit your dentist at least twice a year, every 6 months, so that we can be able to see, to check regarding your teeth, your oral hygiene, and your denture because it also entails a patient's responsibility so that they will have a good oral hygiene.
Napakadami talaga natin natutunan with you, Doc Jomer. So thank you so much for joining us today and sharing your expertise with our viewers. Care for your oral hygiene, go far beyond cavities. More on this when MedTalk Health Talk returns. As we grow older, it's inevitable that we experience a number of physical changes. But it's actually possible in which we can age healthy and gracefully as well. Now, to tell us more about this, let's welcome to the show Dr. Eduardo Romel Poblete, who's a geriatrician from St. Luke's Medical Center. Hello and welcome to the show, Dr. Poblete.
Thank you for having me here.
Please explain to us aging. A lot of people know about this. It's inevitable, as you say, but explain to us the natural process of what aging actually is.
Technically, aging starts from the division of the embryo. What we know as years are actual chronologic aging. But in terms of physical, the organ systems, the tissues that grow, that's biological aging.
What are some of the physical and mental changes that a person undergoes as they age, especially when they reach that point of an older adult stage?
When you go beyond 60, there are changes in the body that are weakened. Your organ systems fail one by one, but they undergo changes like in the taste buds. They begin to disappear. Your food tastes somehow different when you're younger. Your special senses begin to falter, like the eyes, your ears also. However, psychologically, you have that feeling of loneliness that when it goes to the extreme, becomes depression.
What are some of the conditions or some of the diseases that people may experience because of these changes as we age?
In geriatrics, we don't call it diseases. We call them syndromes. Syndromes are commonly used to term the common conditions that may have an impact on the everyday lifestyle of the patient. Like for instance, there's the syndrome of osteoporosis, there's dementia, delirium, dizziness, and even malnutrition. There's also that sleep problems.
You mentioned earlier, which I'd like to touch upon, and that's the syndrome of malnutrition. I think that's something very important because not that many people may expect as we grow older that we are actually at risk of malnutrition. Could you talk a little bit more about that, Dr. Poblete? What are some of the risks of malnutrition as one gets older?
The risk factors for malnutrition are actually, number one, your oral health. You may have dentures as you grow old because you start losing teeth, or the dentures become ill-fitting, in other words. Your oral health also are affected by changes in swallowing. There may be changes in the stomach, that the capacity is lesser than before. Changes in your taste buds, your smell, so that the physical response to food has been altered. It comes to a point when the patient simply do not want to eat any food. They eat less, of course. There are also some changes that the patient undergoes in terms of their food preferences.
Are there any lifestyle changes, especially those who are in their 60s and older, which may lead to the syndrome of malnutrition?
Problems with the growing old is access to food. Nowadays, aging person or Filipino is usually left alone in the house. The older person has to fend for himself. Of course, when they have this osteoarthritis, they have these limitations in motion, or they can't even drive, accessing food, it becomes very difficult. They also have this problem when it comes to finances, the nutrients that they really need instead of the usual carbohydrates or protein-rich food that are simply devoid of certain minerals that are very, very important to them.
Despite the challenges that there may be in order to get the correct nutrients, this syndrome of malnutrition is in fact preventable as well as treatable. Talk to us a little bit more about the ways in which the elderly can actually get adequate nutrients aside from food.
The most important thing is to have yourself assessed. Now, based on this assessment, you're able to define the deficiencies in nutrition of the patient. And we recommend how or interventions to address this. We have to have some substitutes to natural food that they refuse oftentimes, and that's why we have oral nutritional supplementation, or what we call ONS. ONS are simply like milk is the most common example. Some milk nowadays have been scientifically prepared to address illnesses, to address weakness, to address the loss of strength, and even cognitive deficiency in the older adult.
But what exactly do the elderly need? What type of nutrients? How different is this from someone who is younger?
Basic nutrients they need: carbohydrates, the protein, and the fat. But that's the good fat. These are very, very important as basic building blocks of our body. Plus, there would be nutrients like zinc, calcium, iron, or vitamin C and vitamin D and E and even A that will serve as potent antioxidants to ward off infection or to help us in combating the illnesses that we come across.
All of these nutrients are important just for their everyday daily function, but do they also serve as a way for the elderly to ward off any conditions, diseases, comorbidities?
Yes, the diseases are preventable. They are able to combat the effects of illnesses. So these are essential nutrients that can help them combat illnesses, prevent and even avoid the complications that are brought about by illnesses.
We definitely learned a lot with this discussion. Thank you so much for sharing your expertise, Dr. Poblete. But before I let you go, do you have any tips for our viewers, especially those who are in their elderly ages, on how they can age healthy and how beneficial it is to have a healthy lifestyle?
For the viewers out there, it's important to take note of nutrition as an essential part of life. It also will be able to help you optimize the good effects of aging. And combined with exercise as well as good sleep, you may be able to successfully hurdle all the obstacles in an aging society, like Michelle Yeoh, who recently won an Oscar despite her age. She is an example that age actually is not a deterrent in achieving success.
Wise words, Dr. Poblete. Thank you so much. Staying healthy is important at any age, but for elderlies, it is even more important to live a long, happy, and healthy life. I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.